thank you all for being here. I'm super pumped and excited to be sharing part 2 with you. We're going to be talking about falling apart syndrome, adult-onset F.A.S. So many people these days that I meet say, "Doc, I suffer from OLD disease." And it took me a minute. I was like, OLD, oh, I get it. You know, it's like, I must be aging. It's because I'm getting older. I hit this decade. I get this list of symptoms. I hit this decade, another list, and it just goes on and on and on. And start asking questions of, well, maybe these body signals or these symptoms in the body could be telling us something that's going on. So we want to be listening to the body. So we're going to be going through hips, knees, ankles, feet, all in the lower body. We're going to do a little bit of demo here, give you some additional tools to help support your health and your wellness goals here. It's going to be fun. It's going to be active, and I'm very excited to have you here. So I was looking this up. It is crazy and insane to realize that in 2024, the United States spent $5.2 trillion on health care, which we know that's not health care, that's sick care management, symptom management. Now, don't get me wrong, that if there was an acute trauma and that trauma care was required to save somebody's life, I want to be in the United States for that. But when it comes to health care, the prevention, a lot of these things are preventable issues, by the way. When it comes to the prevention of disease and what a stressed lifestyle leads to, when it comes to health care, the United States, we could do a lot better versus just throwing drugs at symptoms. And if that doesn't work, then surgeries and replacement. So I'm going to give you some tools, give you some knowledge to help support you in your health and wellness journey here. So lower extremities, we have to look upstream because a lot of this comes from the lower back, the hips, pelvis, the tailbone, and then it can start to trickle down into the extremities. So a little bit anatomy. So we have the beautiful looking spine right through there. And you have the neck is also known as the cervical spine. You have the middle back is also known as the thoracic spine. Now, did anybody observe my shirt today and why I might be wearing this shirt for this workshop?
Lumbar?
Yes, this is a lumbar jack, okay? And the low back is the lumbar spine, okay? So, which then sits on top of the sacrum, the tailbone, it's also known as, and then you have your pelvis, the two ilium. So 5 vertebrae in your lumbar spine. You have your sacrum and tailbone. You have these joints right out through here. These are called the sacroiliac joints, the sacrum and ilium, sacroiliac joints. And all these nerves here form, what's that big nerve that goes down your leg?
The
Sciatic nerve. Okay, those 5 form a bundle that go all the way down. Here is the hip, the hip socket. So it's a ball in a socket. And we went through part 1. What joint in the upper body mimics a ball and socket? The shoulder, exactly. So this is the ball and socket here. And then that leads into the knee and then ankle and then the foot. So this is what we're going to be talking about this evening. As we said, FAS, falling apart syndrome. Now, we have to understand what symptoms tell us. Symptoms are a body signal alerting us that there is a stress or group of stressors that our body cannot adapt to. That is what is above the water right here, the tip of the iceberg. Underneath the water is the cause of those symptoms. But in modern healthcare today, or our sick care system in the United States, we put a huge emphasis on the tip of the iceberg and not looking at what is the root cause. Tonight, we want to be talking about the root cause. And I want to help you understand and how to speak body signal. I want you to learn how to speak body. What is your body telling you in this moment here? So we're going to be focusing here and getting to the root cause of these issues. And we want to make sure that you're listening to what the body's trying to tell you, because only 10% of the whole nervous system is pain related. So there's a whole other 90% of the nervous system that does not perceive pain. That is function. And we can tell a lot more about one's health based on function than we can on how you feel. Right? Doesn't that make sense? Because we judge how somebody's health a lot in the United States is how you feel. How you feeling today? Oh, I feel good. Somebody tells you they feel good, and then you never hear from them again. Like, there are no, like, what's an early sign of heart disease? Heart attack? You know, what's an early sign of cancer? Early sign of diabetes. So by the time your body exhibits a body signal with those chronic diseases of lifestyle, that means that years have been going on before the symptoms have started. Now we're trying to play catch up if we're able to. But no different than going to see the dentist, right? We go and we get our teeth checked on a regular basis for the health of our teeth. You know, by the time we have tooth pain, is that an early or a late sign of a problem? It's a late sign of a problem. So we want to be proactive here, and we want to attack this with the offense versus waiting to then the body to fall apart. And I know each and every one of you care about your health. You're an action taker. This is why you're here. Okay? And, you know, we have to ask, what is symptoms really telling us about our health? So if you were here or been to any of our workshops recently, I'll ask the question. So if this is 0, neutral. This is high level wellness is a +10, or premature death is a -10. In your mind, put yourself where you're at on this chart. So if you haven't been here, go ahead and do that. And if you've been, think about it over the last month and 30 days. Do you remember where you were at, what would it be, the end of June, let's say? And over the last 30 days, have we made any strides in going in this direction? Because this is where we all want to be going. Optimal health, optimal function. To be able to do the things that we want to do with the people we love doing them with, and not have to work around things. So in your mind, where are you at? And then what direction and speed of that direction are you heading in? This is important that you pause and just give yourself a moment just to be thinking about this of like, hey, how have I done in the last 30 days? Hey, how have I done in the first half of this year? The good news is we just hit that a little bit over the halfway point now. We're at the end of July. We still have 5 solid months to be finishing this year strong and healthy. Because guess what? You all know this. What is coming up in your lives over the next several months? Did I hear taxes? Yes? That could be year-round.
The next one.
Yeah. So even before taxes, the holidays. The holidays are coming, and they're coming like a freight train. And what we eat, what we drink, how it disrupts our exercise regimen, how it disrupts our sleep patterns, the amount of stress that comes with the holidays. So if we want to be healthy through the holidays, when do we start? Now. Yeah, that's right. So be thinking about where you're at and what direction you're going. And I also want you to congratulate yourself on your wins and the things that you're doing. Because I have yet to meet someone who hasn't done something positive for their health and wellness. And it doesn't matter if you think it's insignificant and it's about that big. Progress or not perfection. That's what we want to be striving for here. And look, if you're coming in tonight and you're like, man, I'm way off track. I was trying to get myself to New York and I found myself in Omaha, like the middle of the US. It's okay. Now's the time to course correct, pivot, make changes, and then get back on track right through here. But this is our medical system today. And we have amazing doctors out there, talented, well-educated, many tools to the disposal. But more money and more drugs isn't going to solve our health care system because we're just treating symptoms in that paradigm. We want to be looking, once we're out of symptoms, how can we grow to greater health and wellness? As mentioned, only 10% of your nerves are for pain and sensory. The other 90% are what control your organ systems within your body. Your immune system, sinus and allergies, your breathing, asthma, bronchitis, your digestion, acid reflux, indigestion, constipation, irritable bowel, all these things. And then also your energy levels. Your nerves also control all the muscles in your whole body, but the muscles that go to your lower back, your glutes, your hips, your thighs, knees, ankles, your feet. So we want to make sure the nerves are flowing well. We don't want your spine getting on those nerves. Okay. And all this together, your nervous system is what controls and coordinates your function. But stress is the kryptonite to that function and can start to pull you away from optimal health and wellness. So the lumbar spine, the SI joint, the knees, ankles, and feet, that's what's called a closed kinetic chain. Remember when we were talking about upper extremities and your arms? This is an open kinetic chain because it's not connected to anything. Unless Sean tells you to drop down and do a plank and you have to put your hands right on the ground and, lock your elbows and hold the plank. Now your shoulders become part of a closed kinetic chain. Sean's a certified personal trainer there. So we're closed because the feet are on the ground. So static is when I'm just standing right here. And then dynamic is when we're walking, we're moving. Walking, biking, running, jogging, those type of things right through there. So you have your pelvis. It's made up of 3 bones. Your lumbar spine sits on top of it. You have one bone right here. It is your strongest and longest bone. And what's the name of that one? Anybody? Yep, that's the femur bone right through there. That's the ball at the top. And then it forms a joint with the knee. You have your patella, and then you have 2 bones. Your patella is the kneecap, and then you have the 2 bones in the lower leg. All right, what are the 2 bones in the lower leg? So we got femur here, tibia, and fibula. What's the strong weight-bearing one in the lower leg? Tibia. We got the fibula is the outer one, okay? Non-weight-bearing. All right, and then it leads into the ankle, which is a hinge joint, and then into your foot. Any idea how many bones are in your foot?
A lot.
There's a lot. Somebody throw a number. Use 26, believe it or not. So we're going to get into the intricacies of the foot, the 3 arches per the foot. So good stuff here. So hip problems. 18 years of seeing clients. This is a common problem that I see in the office here. Hello, welcome back.
Sorry.
Oh, you're good. Come on in, Clarion. Where you going, Lynn? You going to the back?
I'm good.
Okay. Okay, you got the seat right there. You're welcome. Oh, I'm glad you can make it back. Okay, here we go. All right, Clarion, we're going to do this team style and get you caught up. All right, team, what does Clarion need to know that we just went over here? What do we want to talk about? We're talking about lower extremities. And what are the lower extremities made of?
Toes.
See, were you here? You were here already. Okay, lumbar spine, the pelvis. What are those two joints where the ilium and the sacrum come together?
Separate.
Yep. Also, SI joint for short. You have your knees, ankles, and then the feet right through there. So we're talking about hips, hip problems where the ball goes into the socket. So you can have, usually when people come into the office and they say, Doc, I'm having hip pain, guess where they point? Where might you even point when you say, I have hip pain? And it's like right here. Okay. That's the sacroiliac joint. So it's very important when somebody says they have hip pain, right, Lynn, and doing a good history. Okay. Can you point to it, please? What do you mean by hip pain? Right here, Doc. I'm having this hip pain. Okay. That's your sacroiliac joint, the SI joint, but I get it because everybody says that. So hip pain, people could list it as that, or it could be like deep into the socket. So it's usually like deep in here. Now, if somebody's having hip impingement, okay, it's where the ball is impinging upon the socket. They're usually saying, I'm having pain like right in here. It's like where the crease is, right through there. Okay. You could have, I'm having hip pain right here. This is usually hip bursitis. There's a big bursa, which is a fluid-filled pouch that goes in between your bone and your tendon. This is your IT band right across here. You have the bursa. The bursa is there so that when you're walking, the IT band can glide nicely right over, it's called the greater trochanter. Okay, and that's this part of the femur bone right through there. So a lot of times, this area will get agitated when the pelvis is subluxated and out of alignment, and there's an imbalance, and this is rubbing a lot, or for my side sleepers, when you sleep on the side and then put a lot of pressure right through here. Sometimes it happens because you're traveling, and then you're in different beds, and the different beds have different firmness and supports and things like that. But you'll see too how it's all connected. Remember that song we learned in kindergarten? Head bones connected to the, all that. It goes all the way down to the foot right there here. Everything is literally connected. There's a whole book called Anatomy Trains that talks about how the top of your scalp is connected all the way to the bottom of your foot. Okay. So then over time, if the subluxation and misalignment is allowed to persist, even if you're feeling good, it's kind of like what happens to the tires when a car is out of alignment. What happens to the tires when a car is out of alignment?
They wear unevenly.
Wear unevenly, then, the car starts pulling and tracking to the side. You don't really notice it at first, but if it goes on long enough, then you start to see the symptom. The same thing happens right through here. So I'll have patients come in and, they can't bear weight. They can't walk on their hips. So I need to figure out what is going on here, because sometimes it's a subluxation in the lumbar spine. Sometimes it's in the sacroiliac joint. Sometimes the ball and the socket have just worn down and it's bone on bone. And so we got to figure out where it's coming from. And that's why it's important to ask good questions and do a thorough history with our clients so we know exactly what's going on. As mentioned, with the sacroiliac joint, the SI joint, that's this joint right through here. On the back side, that would be right here. And when that is subluxated and that is misaligned, what will end up happening is then it will cause more stress and wear and tear on the joint. And then over time, it starts to create inflammation, and all that inflammation leads to pain. So another concept I want to make sure everybody understands is inflammation up, pain goes up. Inflammation down, pain goes down. So the subluxation is a joint misalignment, and that's due to a stress or stressors that the body is having a hard time adapting to and coping with. And what does that mean? Well, that means that it could be a macro trauma. What's an example or a couple examples of macro traumas, the big traumas? Car accidents. It takes just five miles an hour of impact from a car accident to cause a subluxation, and you don't have to have any pain. And sometimes those car accidents happen years ago, and you're coming into the office with the pain, but not realizing that the underlying root cause started years ago. Did I hear fall? Did you say? So falls. So unfortunately, we had a couple of my patients. We'll go back to the car accident just happening in this week, just to kind of let you know what's happening this week at Pure Chiropractic. They were minding their own business, traveling in Minnesota. They were in an Uber. Uber driver darts over, gets into the other lane, had to stop quick, semi behind, didn't see him, and boom. Thankfully, everybody's alive. But this is one of those moments where it's like, thank God that you're alive, because it could have been worse. And then seeing a hematoma on this patient, hit from behind, and take a grapefruit, slice it in half, and stick it right on the back side of that sacrum right through there. Just the blood swollen, pulling, bruising all through there. That's an example of a macro trauma. Then had a patient, minding her own business just yesterday. So, where is she? Is her words, a spectacular fall down the stairs. Thankfully, all in all, she's okay. But an avulsion fracture of the ankle and possibly a torn Achilles, on the other side. So, those are examples of macro traumas and how the body gets subluxated. Okay. Now, the other one is micro traumas. And what might be a micro trauma that we all do every single day?
Sure, look at our phone.
Looking at the phone. I didn't hear you, Michelle.
Trip. You just trip. You get yourself.
Running into things, tripping, stuff like that. Absolutely. Being sedentary, poor posture, slouching, those type of things. All those things add up. That's what causes these joint misalignments. It damages the soft tissue. Ligaments connect bone to bone. Tendons are part of the muscle. The muscle are movers of the joints. The tendon attaches to the bone, and that's what moves the joint. Okay? That's the soft tissue. The nerves come out in between the individual vertebrae, and they go around the muscles, around the joints and everything. Okay? Those are the soft tissues that we're talking about. Subluxations, you'll get a muscle spasm. The joint, the muscles around it start to spasm because your very smart, intelligent body sends signals to your brain to say, alert, 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 damage here. Let me just tighten everything up. So when the muscle spasm, it's guarding the joint. But in the allopathic world, you go see the MD. What do they prescribe for muscle spasms?
Muscle relaxers.
Muscle relaxers. So you feel better temporarily, but now your brain isn't alerting that there's an underlying issue. So we overexert, we can make the problem worse. Loss imbibition. Imbibition is where the fluid is getting in and out of the joint and in and out of the discs. That we lose that ability after adolescence. That our spine, the discs in between our vertebrae require movement to get fluid in and out of the joint. If we're sitting around a lot, we're not moving a lot, inflammations, toxins start to build up, pool in the joint, and that can cause inflammation. And then over time, when a joint is stuck, when it's fixated, when it's not moving in its normal range of motion, this is what leads to wear and tear, breakdown, degeneration, and that whole cascade. which people are like, oh, I got arthritis. Or you go to your doctor and they said, I have pain here. They look at it, oh, it's arthritis. Here you go. Take this prescription right there. Arthritis is an overused term. Arth means joint. Itis means inflammation of. It's an inflamed joint. Initially, it could be red and swollen. If it goes on and persists long enough, then your body starts to deposit more bone in that joint, and now you get the bone spurs associated with the arthritis. That's how when we do a thorough exam, take x-rays, we know how long the underlying problem has been existing. Even if we find things, even if you feel okay. But your body keeps score. And all these traumas start to add up, and we can see them through the evaluation. So knee problems, some common knee problems, like pain on the inside of the knee, could be meniscus issues right on the inside, the outside of the knee, lateral meniscus. You get pain right on the kneecap, pain right in that tendon right below, patellar tendonitis. We can get patellar tracking is where the kneecap pulls off to the side because this muscle right through here gets weak. Those are some pain behind the knee. Those are the most common things that we see within the office here. So right here, x-rays always reveal normal joint space or not. So we can see this is healthy, normal, good spacing right here between the knee. And then this one we can see is a unhealthy knee. The bones is pretty much bone on bone right there. That's been there probably 10, 15 years building up. A lot of people will have knee issues if you've had a knee injury in the past. Over time, the joint itself can become arthritic because of that. Here's a pop quiz. Can anybody tell me what knee this is right there? Is that a left knee or a right knee?
So I have to know that is. So it's right.
We got 50-50 here, okay? Okay. All right, how many people say right? Okay. How many people say left? Yeah, this is about 50-50 right there. Okay, this is actually a right knee. Now, how do we know it's a right knee? Right here is the fibula, and that's the outer part of the knee right through there. So, okay, you didn't know there would be a quiz, but we turned it into a teaching moment right there. So we should be lined up right through here. And a lot of times what I'll see with knee issues, with the subluxation patterns, the knees start to do this. And then when the knees start to go this way, there's this angle that forms, and it starts to build pain right through here. Now, how would this show up in your SI joint? That would be an IN subluxation. This would be is that when your SI joint, your ilium, is internally rotated. So your foot starts to flare out and the knee starts to collapse in. And this is where this pain right through here, we fix a lot. A lot of these problems that are downstream have an upstream cause. So that's why we look at the pelvis. That's why we look at the lower back. And we got to look at the foot on this because if you lose your arches within your foot will start to roll inward just like this. So it contributes to the subluxation pattern. And if that goes on long enough, that's where we start to have pain right through there. But knee pain could be from old sports injuries. You go and you plant, you turn. Those types of ski injuries are very common that we see in the office. Those types of things that will cause the knee issues. Now, if you got an EX subluxation, then the part of the pelvis is going out from the backside, your foot starts to go in, and this is where we start to get the outer knee issues right through there. And then foot problems. We see a lot of foot problems within the office. Quite frankly, the feet are some of the most, if somebody's got a foot issue, we make a foot adjustment. That is usually the most dramatic change that somebody can notice within the office. We get that if the foot is subluxated, we get it to adjust. It could be really life-changing for people, especially it's usually like I start working on somebody's spine and we start getting success with low back pain, hip issues, neck, upper back, or then it comes out, doesn't come out initially, and was like, hey, my foot. I don't know if you deal with foot issues. Okay. We start talking about it. And then we started adjusting the foot. And now all of a sudden it's like life changing. Because when the foot's out of alignment, all that sensory info that goes from where the foot hits the ground, that's got to go all the way up to the brain too. And if the foot's out of alignment, then that'll affect the knee, the hip, and the lower back, and the other corrections that we're making here too. So part of the foot is the ankle. And in our office, we have a foot scan that we do to measure. There's 3 arches per foot. Most people are very familiar with an inside arch. Now, here's a pop quiz here for you. Is this a right foot or is this a left foot? Okay, so
It's right. So
Okay.
that's what you can tell.
Okay, there's the big toe right there. Okay. Over here, there's a side. Okay. Okay, here we go. There's this one. Okay, how many people say right? Okay, do we got any left?
Is it actually left?
No, this is a right. So good job. Good job, team. This is a right one. You got that's a good indicator. That's the big toe right through there. I'll see like these toes. I gotta give a shout out to the toes. Okay, the toes are so valuable, really. I have seen people who've unfortunately had to have their toes amputated, and it's challenging. Okay, but our toes, we just have an incredible body. Okay, like glory to God on that He's given us this vessel. And we want to treat it well, okay, for the years that we've been given. Because, like, there's so much work that these toes do. And you all know about these toes in the middle of the night if you hit something hard. There's a boom, okay? We've been seeing a lot of those lately. And, if it's not fractured, then, we can start adjusting them right away. If not, we got to wait for the fracture to heal. But foot issues, ankle, so you have an inside arch, you have an outside arch, and you have an arch that goes across here. And if any of these arches start to drop, then it affects everything upstream right through here. And we can tell that by looking from behind, and you can really see this with your Achilles, is if your foot is dropping in. This would be flat foot. A lot of people I meet, it's not a surprise when I say, hey, we found some flat feet here. And they're like, yeah, doc, I know that. You didn't have to. So. But it's like your foot goes like this, but look what happens to this joint that the tibia, part of the lower leg, sits on. It starts to go like that. So can you start to see when you don't have a good arch of how that affects this joint and starts to go up? But many times I meet people that they have an eversion ankle sprain. So it goes like this, sometimes this way. But old ankle injuries, if they haven't been properly taken care of, can then start to lead to foot issues, knee issues, SI issues, things like that. See how we're starting to see how it's all connected? So, truth be told, growing old is not for sissies here. Okay. I've had people tell me this right in the beginning of practice. You know what the best advice for me is? They say to me, they're like, Dr. B, don't grow old. Like, okay, we can do this here. We can do this. Okay. Because the truth be told, and it might seem like such a foreign concept, but they've done the studies in indigenous populations around the world that the older folks of the family, okay, like I'm talking 90s, hundreds for some instances, are active and participating within the family culture. But maybe you've experienced in your own family life aging parents, or maybe you've seen it in the marketing commercials out there of aging people. And, at a younger age, you start to see them incapacitated, unable to do the just day-to-day stuff. So it's well documented that our bodies are designed to be healthy, functional, and continuing to do that as we age. If we give our bodies what they need and we avoid as much as we can, progress, not perfection, the things that it doesn't need or doesn't want here. So we're going to dive into self-care and some things that we can be doing to take care of our lower body here. Okay. So, forgot something. Lynn, would you be so kind? And will you bring up one of the massage guns, please? Okay. All right. Do we have one of these in the house? Okay. All right. This is a foam roller. They come in all different shapes and sizes. This one's a cool one. I was just going to give a shout out to this. A chiropractor designed this one. So they have this part here, this indenture, because your spine goes right into this. So to get the muscles right along the spine, right through there. So as we're talking about foam rolling right through here, various shapes, sizes, sometimes I've seen these, they look like a torture device. They've got spikes and everything like that. And I can handle some pain. Like I'm not, I can push in, a bit. But some of those ones with the spike, it just gets to be a bit too much, overwhelming here. Thank you so much. Okay, so when it comes to foam rolling, let's talk about lower body, some quick hits and then easy wins. So first off, I can't demonstrate without at least including a little bit of the upper body because this is such a good one for everybody here. So I'm going to go on the floor here to demonstrate. So if you need to stand up to see, so feel free to do what you need to do. So this is hitting the thoracic spine. This is one of my favorites right through here. So you just tuck your head just a little bit. They come through. You might have heard a few pops in there. Okay, so just going and just basically the top of the upper back to the bottom of the rib cage. And I just do a few passes like that. You can give yourself a hug. I love me. That positive self-talk. And then go to the right side of the spine and go up and down just to get the muscles on the right side a little bit more. And then going on the left side right through here. And quite literally, that's about as much time and intention that I do for my mid-spine. And I pretty much do that once a day. Now, how do I make myself successful in doing this once a day? I've invested in 3 of these. So I have one upstairs, I have one on the mid-level of the house, and I have one in the basement. Because I don't want to be hunting around for these things if I'm going to do it. So think about when it comes to wellness, just smoothing the edges and rounding things off to make it easier for you to be able to do these things. All right, so this is a good one for the glutes. So as we're thinking about the hips and the lower back, sciatica, this is going to address what's called the piriformis muscle. It's a deep glute muscle, and underneath this muscle is a sciatic nerve. So you get on this, you cross like this figure 4. My arm is stabilizing myself, so I could actually increase or decrease the amount of tension. So I want you to see that. And then you just go like this, back and forth, right through here. I'd probably go like 10 times, and then I'm going to rotate just a little bit. Just going to move in just a little bit there. Just hit the muscle just a little bit differently. Remember to breathe, okay? I had a patient today. He was like holding his breath while I was testing. I was like, breathe. He's like, I forgot I wasn't breathing. I was like, yeah. So that's pretty important. So you go like this and go back. If you hit the pain point, when you hit the pain point, just stay on it for just a few seconds and then roll past it. Just like that. Just go. And then you switch and come to the other side right through here.
So what do you do if your shoulder can't support that?
Okay, I'm glad you asked. We got options. Remember, we talked about that, right? We got options. So if you have a foam roller, this is what I'd do for that. If you don't have a foam roller, or you can't because of other orthopedic issues. Thank you, Lynn. Love this guy. Because I use this a lot more than I use foam roll. When I first was in practice, I was using foam roll all the time. I'm not poo-pooing there. I love it. I love it for the mid-back, really, because I can't really do that so well. But if you have this, then you just go like this.
Yeah.
This is what we do. It's nice and easy. Around like that. Okay. Oh, Barbara, I'm thinking of you. Boy, I'm still thinking of you. Because I'm on the right arm. Okay. Right through here. Okay. And if we're not able to do that with the right arm, we thank Dan for his participation right here. And so Dan, and I would recommend lay down for this one. And then you just go like, see where I'm at? Here's the belt line, just to give you us an idea. Just going back right in here. Just like that. And then this is a good spot right through here, the glute medius. This will get tight. And then switch and just go back the other way, right through there. Both are beneficial. We'll say one or the other, but those are the options that you have based on what tools you may have around. Is that your question from the last workshop keeps ringing in my head. I love that question. Got me really to think. When I'm traveling, what do I bring with me? And the first thing that I was like bringing with me is I'm bringing what? You remember what I was telling you? Supplements. I'm bringing my supplements to make sure I'm getting nutrients in, because I might be eating a little bit off plan. So I take my supplements to give my body the nutrition it needs while it's traveling. And then I have to improvise based on where I'm going and who I'm seeing and what tools they might have available. So my family in Michigan, maybe I've rubbed off on them over the years. So they pretty much have these tools when I go to their homes. That's good. All right. So, so we went through thoracic, we went through the glute. All right. Let's show the quads some love, because when you're sitting a lot, you're in this flexed forward position. Everything on the front side starts to get tight, including your quad right through here. Well, that attaches to the upper part of the pelvis and then your kneecap. A lot of knee issues, the quad's so tight, it's pulling the kneecap up. So then it starts to scrape right through here and create some knee issues. So this is how we address the quad. So you get on the ground, quad there, and basically we just roll right through here. There we go, straight up and down the center. Then we flare the foot. So if you could say, turn the foot out. And then we start to get on the inside of the knee, a little bit of the abductor on the inside of the thigh. And then we rotate the foot the other way. And then we're not on the IT band yet, but we're kind of between the center of the quad and then the IT band, doing this right through here. That's a really good stretch and working out the fascia. So the fascia is the saran wrap that wraps around the muscle. And sometimes that starts to crinkle up, and we need to flatten that out and smooth that out right through here. Yes.
Will you consider doing a workshop just on the fascia?
Sure. Yeah, definitely consider doing that for sure. Mm-hmm. And then now we'll show the back of the leg some love. What's this muscle called?
Hamstring.
Hamstring, exactly. So that's the back. Okay. And so we go here. The same principle. Just going back and forth right through here. Now you turn your foot in, get a little bit more on the inside of the hamstring, and then turn your foot out, and then you get the outer part of the hamstring. What do we do when we hit that pain point?
Stay a couple seconds.
Yeah, stay on it for a couple seconds and roll through it, or you can just do like a little back and forth just to kind of work it out a little bit. Okay. Any questions on the quad or the hamstring and the foam roller? Now, moving on to everybody's favorite one to do is the IT band. This is probably the most, at least for me, most painful. Talking to my clients, very painful. So you position yourself right through here. Again, I'm controlling the amount of pressure I'm putting on this, but as you go up and down right through this side. I'm feeling a little bit of my run this morning. So I'm just getting in through here, foam rolling that out. That's that IT band right through there. That can be quite sensitive and quite painful for people right on this side. Now, back to our other friend right through here. Okay. This is a really good one. You can sit down and do this one too. This work right in quad. And it is kind of, when you're doing this, kind of fishing around a little bit. Like when I'm doing this, I start to get right here and I'm like, ooh, that gets a little bit spicy. Yeah, it sounds, it's going to work that out just a little bit right through there. But not like this doesn't bother me. And then I'm going to get into the inside, whereas here something with foam rolling I was noticing. But not to it, right about in here. So you start to work it and you start to target in on those areas that are more sensitive. Right through there. Okay. Any questions on that one? Okay. All right. Lynn was talking about this one earlier. We're going to move on to the calf. I think Lynn's really been working on this one right here for herself. Okay. So the calf, this is a fun one because you can do this. Go fairly light, just working the calf muscle. Or if you're feeling ambitious, you can put your other foot on top and that really increases the intensity. So going up and down, slightly turning your foot in, going to the inside, and then going out and working it just like this, right through here. So that's how you use the foam roller and those parts. This could be very helpful too, especially getting to the outside. So if you're having like pain that kind of wraps around this bone here and goes into the side of the foot, you got to work upstream right through here, just like that. Work on that tendon. If anybody dealing with like heel pain, like plantar fasciitis, that is the classic right here in the bottom of the foot. When you get out of bed in the morning and we're doing like this type of thing and 20, 30 steps and it starts to loosen up. Always got to look to the calf because the calf is probably overly tight and pulling on the Achilles, which is then affecting then the heel and pulling on the bottom of the foot. Okay. So much good stuff here. All right. Okay. So ice, we want to ice any painful joint, especially if it's like over you. If you got hip issues here, put some ice on it. You got overuse, overtraining or something with the knee, try ice. Ice works really good on getting inflammation down, which will help with the pain. And then we're going to talk about exercise because simply put is if you're able to, because of we're talking lower body, unless an orthopedic issue is prohibiting you from doing this, walking, movement, those type of things are really good for the joints.
When do you use heat?
He is, if you have a chronic arthritic joint, so let's say you have like a degenerative joint, we'll just say from a knee, okay? You can use heat on it too to get more blood flow to the area. Or if heat works really good if there's tightness within the muscle or the joint. You can use contrast to try too. Do a little bit of ice and a little bit of heat. Ice creates constriction, gets the inflammation and blood flow out. Heat then allows the blood flow to rush back in. So you could try that too. See how your body responds if you have both right through there. So it's a good day to squat. All right. So we're going to talk about squatting right here and the importance of squatting and doing it the right way. Because there's a lot of ways that you could do this and then could injure yourself So, all right. So we can learn a lot from kids, can't we? They know how to squat. They're limber, things like that. So essentially the way that, I don't know if you all know this, but you all know that Lynn's a certified personal trainer?
Yeah, certified.
Yeah. She's a certified personal trainer, and that's how Lynn and I met, actually. It was at Fitness Together.
Thank you.
Thanks for coming. At Fitness Together. And she is one of the trainers that taught me how to properly squat. Okay. So I didn't injure my back. It's been incredibly helpful. So when you're doing a squat, always do what you're able to do. Okay. Don't go beyond your limitations. If your body is giving you pain signals, let's say 4 and above, that means that you're stressing the joint and the tissue too much. So you have to slow down. Okay. But if it's a 1, 2, or 3, and it's more like sore or discomfort, you can work through that. But when you're doing a squat, you want to make sure you got feet shoulder width apart. Okay. Your weight is on your heels, not on the balls of your feet. So when you're coming down, think of a hinge. Like you're going to, the best way that I could say is you're going to sit down into a chair. You're coming down back here, weight on the heels. Knees are tracking over the toes. We're trying to avoid taking the knees in front of the toes. That puts too much of a shearing force on the knee. You're going to keep a good, strong chest. You're going to be upright, and you're coming down like this. And then you're coming up. So you want to be looking ahead and coming down, and you want to go as low as you're able to. Sometimes that means putting a chair behind you and a cushion so you can gauge how low you go, tap, and then come back up. It's so important because doing the squat properly strengthens the glute muscles, which helps support your lower back, your hips, and your lower body. A lot of knee issues come from weak glutes. You're going up and down stairs, your glutes aren't firing, and your knees are being overused. But doing this one exercise can be a game changer, and doing this daily. So challenge yourself to do one set of 20 squats. If you have to break it down, 2 sets of 10. But doing that consistently, strengthening those muscles around the hip, that's what we want to be doing there for the lower body. Okay? Lynn, what'd I miss? Am I a good student? Did I learn it all from you? Okay.
Flat back.
What's that?
Flat back.
And the flat back, so you're not rounding it. So part of that is the strong chest. Yes.
So I was taught, I'm not going to get up and do it, but it needs to go out and go down
Mm-hmm.
rather than keep it. Okay.
Mm-hmm.
That's not right.
Okay. Yeah, are you coming up to them, sir?
So go on a little bit this way rather than keep it. No. Oh, Sean, you can weigh in. So no.
You only force the moves.
So the only time that I've ever heard that and I've disagreed with it was from my CrossFit group, where they had their feet out and flared out like this and coming down like that. I don't like that. Okay.
So toes straight, but out.
Toes straight and coming down like this is what you want to do. And you want to keep your knees in a straight line right through here. We don't want them bowing out. Now, if they are, there's ways that you can work with that, which you can take a band and then you can put a band on the outside if your knees are going in, and then you put a ball between your knees if your knees are flaring out. That's how you work it. Okay? All right. Good stuff. But this one single exercise is the foundation to a lot of life for you. And what I mean by that, this happens in so many different things. Okay, let me grab something off of the ground. Okay, like this. All right.
Let me strap somebody into the table.
Yeah. There you go. Coming down like this. All this, cooking, brushing your teeth. So many activities of daily living. Getting on and off the stool, coming down. Challenge yourself to be able to get up off of a seat without using your hands. Challenge yourself with these things. Okay. But there's so many things with activities of daily living that require us to do this and do this well. And so many other exercises hinge off of that, pun intended. All right. Okay, so professional care out for these things, you go to your medical doctor, you go to a physical therapist, a massage therapist, active release technique practitioner. They're all great. They could treat the symptoms, but we got to ask, what's the goal? Is the goal just to get out of the pain, or is the goal to get out of the pain and be functional? And we want to be functional and healthy here. Because the allopathic options, heat and bed rest, which that heat is a little bit different than what I'm talking about. Do nothing and just throw heat on it. That's not what I'm saying when it comes to heat. Heat can be applied at the right time. Drugs that kill the body signals and pain signals so you don't feel anything. How many times you see on a Leaf commercial with people playing a sport, I'm going to pop some Leaf before then I go play. If you're feeling good, you go play.
Don't hurt yourself.
Yeah. Physical therapy. Physical therapy is great. I've been to physical therapy. I love it. Help me recover from my shoulder surgery. Okay. But physical therapy alone is not going to fix subluxations. Okay. Steroid injections. You're probably aware of this, but that's why they limit steroid injections, because the steroid injection actually destroys, disintegrates, debilitates the cartilage within the joint. So the joint actually gets worse over time. It's counter to what ultimately we want for health and function. Pain management, kind of going off that, or surgery. We always want to look about what we can do as naturally as possible if we're able to. So get to the cause. Subluxations in our spine create lower extremity issues here. How do you know if you have subluxation? Well, you get checked. We don't guess around here. We test. We have scanning equipment that can measure how the nerves are firing in the lower extremity and the whole body. By movement, at palpation is feeling the joint range of motion here, looking at posture, and then x-rays. We find with hip, knee, ankle problems, the lower extremities, L3 to L5, the sacrum, and SI joint subluxations. This is typically if you're getting a manual adjustment when I'm adjusting you on your side. If we're using the drops, that's where the table comes up and then it drops down. And or if you're getting stretched on the table. Those are all things and types of adjustments to correct this. So we got to stop the habits that are causing this in the first place. Add specific exercises. Gave you some tools here tonight. Start adding in and incorporating. And then keep your adjustments consistently here. Keep them in rhythm. And then we want to build that momentum over time. Really cool story here that we'll end on. Regina, she was actually in earlier today. She unfortunately could not be here this evening. Regina was referred into this practice by her husband. She came in, had retired. She has retired for 2 years. And finally, her husband, have been getting great results under care, said, I want you to come in and I want you to see Dr. Brandon. She was a little bit hesitant, kind of like, why are you here? Because my husband said to be here. James said to be here. But I thought I'd give it a shot. 2 years retired, and I'm having hip pain. My goal is I want to be walking 5 miles a day. I'm like, cool, great goal. That's an excellent goal. She's like, I don't understand. I'm retired now. I'm not tethered to my desk. I should be able to. These are my golden years. I should be able to do the things that I want to be doing. And how come I'm not? Well, we're going to evaluate you today. So we did an evaluation. We showed her x-rays, phase 2 subluxation degeneration. And said, here's your problem. And 18 years helping people, we can help this. Not going to happen overnight. It took time to get like it is. We're going to get you better. I said, okay, let's do this. Had the goal in mind. And her life's been pretty challenging. There's been some stressors coming up, family health issues. She's had to travel a lot, so on and so forth. But she's found a way to get it. And over time, there were some ups and downs. Started to get a little bit better. And then she'd overexert herself and was like, how come I can't walk 2 miles? Well, how are we doing now? Well, I'm able to walk a mile without any pain. Okay, now we're getting somewhere because she wasn't able to do that. That just started slowly, gradually. And then she was just in today. We just had her progress eval. And she's like, I'm 100% better. And we have it on MRI too. We have an MRI along with the x-ray that shows she has a torn labrum. So that's the cartilage around the ball and socket to hold the ball in place. Even with that going on, with the chiropractic adjustments, specific exercises to help strengthen, and consistency over time, now she's feeling better. She's walking 5 miles a day and no pain. And it's not the next day or anything like that. She can continue to do it. And we see on her nurse scores, they continue to go up. So her nervous system and her body is becoming more resilient to the stress. How cool is that? You know, that's when we say, good job, Dr. U, because I'm not the one doing the healing. Her body is the one doing the healing, helping to remove the interference, give the body what it needs, and the body will take care of itself. So I want you to be thinking about how old do you want to live to? How many people here want to live to be 94? Anybody here wants to be 94? We don't even have to stop at 94. Okay? We don't know how many years that God has us on this planet, but for the years that we do have, we want to be living them well. Not just about adding years to life, it's adding life to years. So I thank you all for being here this evening. I know you got a lot out of this. I look forward to you applying the things that we taught here, and I want to hear back from you about what's working. And look, and if anybody needs any modifications of what we're doing, what we learn, things can always be modified, and there's always a way. So thank you for being here. If anybody wants to stick around after, has any personal questions they want to ask me, please feel free to do so. If not, have yourself a beautiful night, and enjoy the last evening, second to last evening and last day of July. What a great month this has been. August is around the corner. At the end of August, if you're curious what our next workshop, but I let it out of the bag. Our neck workshop is our next workshop. And so you can already guess what shirt I'm going to be wearing for that. Neck, fix, and chill. All right, let's all bring it in here for our selfie at the end.